So Basil, I'm actually just going to have you lean back toward me, try and arch your back. Excellent. My name is Maureen Rogers and I'm a physiotherapist here in Summerside at the Summerside Physiotherapy Clinic. What inspired me to go into physiotherapy was when I was in high school, I knew I wanted to go into the health professions or healthcare in general, and I actually had an older sister who had orthopedic knee surgery. And when she came home with her post-op knee exercises, I thought that was a really very interesting, and I had no idea that that was part of a post-op treatment plan. So I really was quite wowed by what she had to do and then became interested in physiotherapy. The only university for physiotherapy is Dalhousie in the Atlantic region, so to go beyond that, the closest English university I believe would be at McGill or the Ontario universities. But primarily it would be Dalhousie because they, at the moment, I believe, only take students from the Atlantic region. To excel as a physiotherapist, I think the skills that are probably most important, certainly the desire and the ability to work well with people, because again, having such a close relationship with your patients, you want to enjoy helping people with their problems, and people do have problems. So it's most often we're seeing clients that they either have pain or they have significant physical limitations. So they come with significant issues that you're helping them to resolve. So the ability to relate well to your patients, to have patience, because rehabilitation can be slow at times, so you don't always see immediate results. So people skills, patience, and the desire to really affect and change the outcome of someone's situation.
My name is Denise. I'm the physiotherapy assistant here. I work with the physiotherapist and help with the treatment plan and also treatments that we do with you. Okay.
The other option for someone who's interested in the physiotherapy profession or in the physiotherapy field is a physiotherapist assistant, and that's a relatively recent area of healthcare. And the training to do that is approximately 2 years in a college environment. One of the colleges in the region that provides that is the College of the North Atlantic in St. John's, and I believe also a college in Dartmouth that provides that. And we've heard some discussion that there may be a college in Charlottetown that's also going to be offering physiotherapy assistant training. It is very much a team environment. We have ourselves, there's myself as a physiotherapist in our clinic, we have another physiotherapist, and we have a physiotherapy assistant who works with both of us. And the relationship with the physiotherapy assistant essentially allows us for each of us to work more within what we call our scope of practice. I mentioned that a physiotherapy assistant has training, probably 1 to 2 years at least of training. So those skills in our clinic setting are invaluable. So it allows the assistant to work within their scope and ourselves to do the same so that we're not duplicating as many job functions. So it is a very close relationship. You may have a patient come in with a back injury or a back problem, and I may assess them. I may do certain what we call mobilizations, which is hands-on treatment, or teach specific exercises. But then our assistant may also do some exercise instruction, apply treatment, may start some new exercises, so it's a very close collaborative relationship. The best thing about being a physiotherapist, I think, is the fact that you can have such a close relationship with your patient and help them to make positive changes in their life, but most importantly, giving them the self-management tools to do that. Physiotherapy isn't a passive process, so a lot of times we're educating, we're instructing in exercise, we're talking about ergonomics or how they can change their home or work environment. So I think it essentially empowers our patients that we give them the tools to help manage their situation or their problem. And I think that's exciting when they come back and say, I tried what you suggested and it worked. The advice I would have if someone is considering physiotherapy would be to try and educate yourself and expose yourself to as many physiotherapy situations as possible. Physiotherapists, because they do work in a wide variety of settings, you may want to visit a hospital outpatient department or a private physiotherapy clinic where you have more exposure to orthopedics. You may want to connect with a pediatric physiotherapist, so you're actually seeing what physiotherapists do with very young children in those environments. You may want to volunteer or collaborate with a sports team where physiotherapists are involved. So the more that you can expose yourself directly and have hands-on experience, the more you'll understand the broad base of what physiotherapists offer and what the profession has to offer.